Now more than ever, we know how important healthcare is to each of us and collectively to all of us. But we also know it is more costly than it should be, and that our outcomes and experience aren't what they should be either. Typically, we look to the payers, providing institutions and policymakers to make a difference, and they certainly can. But I believe there is another group that is often overlooked and who can make a significant contribution. And that group are patients. That's right, each of you when you go to seek care from your doctor. How? Simply by making some thoughtful considerations before, during, and after your encounter that can influence the doctor to yield better outcomes and experience for you, and often also at lower cost. With 1 billion such doctor-patient encounters in the United States each year, that has real impact potential. And what's more, these same considerations also improve the lives of doctors. Doctor burnout is a prevalent condition. 80% report feeling sometimes or always burnt out. 20% report feeling even depressed to the point of worrying about making medical errors. And they also contemplate and sometimes even tragically commit suicide, which then means increased administrative burden leading to burnout for those still working and less access for patients and worse outcomes and experience. As a doctor on the front lines and a healthcare consultant behind the scenes, I've thought deeply about this, and I've put it together in a 3-step framework of S, T, and I for you as a patient to start taking initiative. Here, I will run through 3 S's to think about before seeing a doctor, 3 T's to think about while seeing the doctor, and 3 I's to think about in follow-up care. 3 S's before seeing the doctor. Number 1, scarcity. There are 2.5 doctors for every 1,000 Americans, and this low ratio is getting worse. The American Medical Association anticipates a deficit of 120,000 doctors over the next 10 years. Now, we doctors go into serve, but we know that demand is greater than we can supply, and so we want to be used where we can provide the highest value. We don't have a problem with adding lower value with refill requests or routine checks, but we're conscious of those patients where we could have provided higher value, such as acute and complex problems, but who could not get access because of that scarcity. And so as a shared responsibility to think about this, because you never know when that patient that couldn't get access is you. Number 2, selection. As doctors, we perform best with certain conditions and certain settings as we're trained. Now, sometimes we're faced with patients not in favorable circumstances, but we will always try and do our best to not disappoint expectations. But that may not be the best for you. As a patient, you have the power to be able to guide this yourself in advance in thinking through, does it need a doctor at all? Nurse, pharmacist, or other allied healthcare professionals now do more and more and are more accessible. In the right setting, because 2/3 of emergency room visits have been found to be better dealt with in primary care and save $32 billion a year. So while your emergency room doctor has the responsibility to reassure you that there's no emergency, your primary care doctor has the responsibility to go further and correctly diagnose and manage you through. And in choosing the right doctor for your particular problem, important metrics to look at are their qualifications, their track record, and professional interests in your area, in the area you need. But metrics that do not make a difference are their sex, their sexual orientation, their age, or their zip code. And so finding the right doctor working in the right setting with the right conditions will more likely yield the right result for you. Number 3, supporting information. In this era of increasing technology, we capture most of our lives. And why not also illnesses? If you have a rash, take a picture. If you have a cough, record a voice note. If you have pain, find a way to draw and map out where, diary when, and describe how and send it ahead of time. With chronic conditions such as hypertension and diabetes, there is increased proliferation of home devices and remote monitoring, so you can have the readings that capture your real lived experience. We get energized in dealing with this because we know we can then provide you with a more accurate and better management plan rather than based on one reading or trying to guess your symptoms. And so where you can, snap it, map it, and tap it, and share it with us. 3 T's during your encounter. Number 1, time. Doctor's appointments are typically short, 5, 10, maybe 20 minutes at best, and so even 2 minutes is a significant delay. Doctors interrupt patients on an average of 11 seconds in, and so with delays, that's likely to be even earlier, which means less chance for you to tell your story, but more chance for misunderstandings. When faced with a time squeeze, it creates an internal conflict in thinking about spending that extra time with you and delaying the others. And that is a distracting thought that means not being fully present and likely to yield worse outcomes. And it certainly increases feelings of burnout. So never mind birds and worms, the early patient certainly catches better care. Number 2, trust. 80% of doctors report the doctor-patient relationship as being the most satisfying part of their job. As humans, when we feel trust, we're more likely to reciprocate trust. In fact, studies have found that patients who trust their doctors have better outcomes and also feel better about their experience. When we feel trust, we're much less likely to be distracted to worry about an impending lawsuit or complaint. Conversely, when we don't feel trust, we're likely to resort to defensive medicine, where we order extra tests and other opinions, all at increased time and money cost to you without necessarily expecting a better outcome. And so trust us, we're doctors. Number 3, taking part. Even though you access the doctor's expertise, the appointment is fundamentally about you and your personal dreams and deadlines. In this era of democratization of medical information, you have the ability to look online and find journals, education sites, and patient forums. And with that, you can research and reflect ahead of time to bring your ideas, concerns, and expectations. We love proactive patients. Maybe contrary to opinion, it makes us feel that all that sacrifice that we spent was worth it to be able to get that patient in front of us to live their best life. Proactive patients also are humbling because they remind us that we don't know about each individual's possibilities as they weren't in the books or taught to us by our seniors. And also inspiring because it helps us learn and makes us want to be better for the next patient. And so you have the possibility here to not only influence better outcomes for you, but also for others. In this dance between a doctor and a patient, it really does take 2 to tango. 3 I's after seeing your doctor. Number 1, investigations. It can seem that the more tests, the better, but tests are not a free hit. They not only cost more money and time, but they can also sometimes cause harm, such as with CT scans and the radiation that they come along with. Tests also have the risk of generating false positives. When tests are done and the right populations where it's more likely to be applicable, the test results are more accurate. And conversely, when they are done in populations where it's less likely to be true, then the test results become less and less accurate, and sometimes even to the point of becoming a coin toss. One study looking at women who'd had an annual mammogram for 10 years found that half of them had received a false positive that had generated increased anxiety, further tests, and sometimes unnecessary surgery. So it's a case of buyer beware. The more you look, the more you'll find, and once a test result is known, it can't be unknown. Number 2, interventions. Contrary to the popular maxim of do no harm, every intervention has the possibility of harm within it. Iatrogenic causes, a fancy way of saying medical treatment-related causes, are estimated to be the 3rd biggest killer after heart disease and cancer, leading to up to 250,000 deaths each year. To put that in context, that is half the number that were victim to the opioid epidemic over many years. Now, sometimes the bad outcomes are due to malevolent actions or bad actors, as in the opioid epidemic, but by far most of the time it is simply inherent in the risk of practice. And so infections from being in hospital or from medications, unexpected allergic reactions or side effects, or complications from operations. And so even with good intentions, medical interventions can have bad outcomes. Number 3, interim uncertainty. If things are not getting better afterwards, it is natural to reconsider if you'd had the best opinion in the first place, or whether a second opinion with another doctor would be better. But second opinions create conditions with an inherent bias to action, which don't always yield better outcomes. One study of orthopedic surgeons found they were much more likely to operate on an identical case, only with the addition of being told that another doctor had seen it previously. So what about giving a second chance to the first opinion? We doctors know we don't always get it right. And even more, we know that even the right medication doesn't work on all patients, and that some conditions just take time to get better. But we are very happy to work with you and to rethink and to update the plan, which may well include going to see a second opinion if that's what is best. Now, whether you give a second chance to the first opinion or go for a second opinion, that takes us back into the framework and the considerations of the 3 S's before the appointment of scarcity, selection, and supporting information, the 3 T's during of time, trust, and taking part, and the 3 I's afterwards of investigations, interventions, and interim uncertainty. And so, while I wish you the best through this pandemic and beyond, when you do next need to see a doctor, I'd encourage you to think about the STI framework and start taking initiative. And with that, I will stop talking immediately.